So my first talk of the day is labeled Transanal Resection Techniques for Rectal Lesions. It's a technical talk. I have no financial disclosures. The objectives of this talk is to discuss the indications of transanal resections, what options we have in terms of platforms, and a technical demonstration of the TAMIS and the robotic approach. The indications are pretty straightforward: benign lesions of any kind, T1 lesions with no high-risk features, meaning they are well differentiated, no lymphovascular invasion, no tumor budding, no moderate or poor differentiation. They are fair game. Carcinoids, GSTs, GISTs, and palliative resection. So palliative resection is a controversial issue, but there have been series where patients who are not candidates for surgery, you can do a palliative resection transanally to alleviate symptoms, and other like resection of scar. So how many of you perform transanal resection in your practice? Okay, thank you. And of those who don't, how many plan to start it? Awesome, great. So after this talk, especially if you're somebody who wants to start it, please feel free to reach out and I can share resources. In my opinion, it's one of the most technically challenging things we do as colorectal surgeons. Apart from the big recurrent rectal cancers, these cases are most technically demanding. There is a steep learning curve, and any procedure where there is a steep learning curve, there is a tendency to compromise on quality, especially in the beginning. That is a big thing to keep in mind when you're starting it. Start with benign lesions. You do not want to start with a malignant lesion and get a positive margin, and now the patient needs a bigger operation. The goal is to avoid a resection and to preserve the rectum. It is difficult because the space is limited, visualization is limited, the instrumentations are archaic. You know, the straight laparoscopic instruments that we use, they don't reticulate, they don't have endo wrists, and that makes it very hard, and you're working at a greater distance. So these are the options that we have today for removing lesions transanally. The conventional transanal excision, transanal endoscopic operation,